Yes, I would. All so the question is,
Check, check.
I have that. So for some reason, I'm only getting on SDI and not the XLR Center. So the XLR Center is different.
I got that. Perfect.
So I'm just gonna use the SDI.
Okay.
And we're gonna run with that.
Okay.
I just have to. It means it's a little harder for me to adjust those. That's fine.
Okay.
As long as I have audio.
One, two, two, two. Check, check. Mic still sound okay? Okay. One, two. Hey, Matt, I'm gonna bring down the mask. Tell me when it sounds okay. One, two, two, two. Check, check. One. Good. Check, check. One, two, two, two. Check, one, two. All right.
Down at the bar like a star. Ladies and gentlemen, please find your seats. We will be starting shortly. Ladies and gentlemen, please find your seats. We will be starting shortly.
When they've left you for dead, and you can only see it, you must find a way.
Hello, everyone. If you could please find your seats, I believe we are live streaming. Well, good afternoon. I'm Rhonda Bridgman, Regional Chair of the Hampton Roads Chamber. It is both an honor and a pleasure to welcome you to this hybrid edition of our 2020 State of the Region Address, which is live streaming from the ballroom at the Marriott. For those of you watching the virtual feed, State of the Region books are available at our new Hampton Roads Chamber office, which is located at 101 West Main Street, 8th floor of the World Trade Center. And that's in downtown Norfolk. Feel free to stop by and pick up a copy at your leisure. I would like to take this opportunity to thank you for your continued support to the Chamber, and I know Brian will echo that sentiment. So without further ado, I would like to introduce Brian Stevens, our President and CEO.
Well, thank you, Rhonda. As Rhonda said, my name is Brian Stevens, and it is a distinct honor, a true honor for me to serve this region as the President and CEO of the Hampton Roads Chamber. The chamber, by the way, that is unapologetically pro-business, and the chamber that is very proud of the fact that it was accredited by the United States Chamber of Commerce with 5 stars, the highest accreditation that any chamber in the United States can achieve. I'd like to recognize my staff for that honor. Our role in the region is to set the conditions so that businesses can succeed. One of the ways we do this is by educating and informing the business community in ways that allow them to make sound business decisions. Our strategic plan positions us to be an impactful advocate, a powerful economic partner, an inspiring igniter, and a regional collaborator. This event touches on all 4 of those strategic pillars. We are pleased to continue our partnership with Old Dominion University, Dragas Center for Economic Analysis and Policy to bring you this impactful event. Ladies and gentlemen, to get us started today, I'm going to ask you all to please stand as I ask Sarah Kingsley to come forward and sing the national anthem for us. Sarah?
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Seated. Again, thank you, Sarah. We appreciate it. I also want to take this opportunity to thank our generous sponsors. Our presenting sponsor today is Optima Health. Our silver sponsors are Clark Nexon, Old Point National Bank, and the Port of Virginia. Our bronze sponsors are Crenshaw, Ware and Martin PLC, Palladium, and I also want to thank all of our table sponsors, which are in your program. So ladies and gentlemen, please join me in a round of applause to all our generous sponsors. As our chair said, we're live streaming this, and I know we have a lot of dignitaries who have dialed in to watch this presentation today. We have several that are present with us in the room. I'd like to go ahead and recognize those. First of all, our host mayor, the Honorable Mayor Kenny Alexander. Also, the city manager of this great city is with us, Chip Fowler. Chip. Also want to recognize Doug Smith, a colleague of mine who is the CEO of the Hampton Roads Alliance. And since we're here to talk about the region and our economy, I just want to give a shout out to Doug and his team and all the regional organizations that have come together over the last 6 or 7 months to do some analysis and put together what we call the 757 Recovery and Resiliency Plan. It's an action plan that hopefully will help us get through this pandemic and then really accelerate our recovery once we get through it. So Doug, thank you for your leadership in that effort. Appreciate it. Also want to recognize the Dean of the ODU School of Business, Dean Jeff Tanner. Jeff, thank you for being here. Now I'd like to ask a good friend of mine and somebody that I admire both personally and professionally, James White, to the podium to deliver today's blessing. James is the Regional Director for Safe Light Auto Glass, and he just shared with me that he's also not only taken on the Richmond Hampton Roads region, but also taken on the Washington, D.C. region. So congratulations for that, James. He's also a member of the Hampton Roads Chamber Executive Committee and has been nominated to do that again next year. So congratulations on that, James. And he's also an elder with Spring Branch Church. James, please come forward.
Thank you, Brian. Will you all join me in prayer? Father, we come to you this morning with thanks. Thank you for this amazing region that you have blessed us to live in. Thank you for the leadership that we have in this community. I ask, Father, that you would bless them, bless our leadership with wisdom, with compassion, and with the heart to work together. For we know, Father, that we can get much more done together than we can as individuals. These and all blessings we ask in your name. Amen.
Thank you, James. Appreciate it. Ladies and gentlemen, please enjoy your lunch. Eat quick, though, because we're going to start the program here momentarily. Thank you all very much. Okay, ladies and gentlemen, please continue to enjoy your lunch. And I've been told to let you know that there is coffee on each end of the ballroom here. It's help yourself coffee to enjoy that zero-calorie apple pie that you have in front of you. Ladies and gentlemen, it's my honor now, and I ask you to please join me in welcoming another member of the Hampton Roads Chamber Board of Directors, a good friend, and a member of Optima Health, our presenting sponsor, John DeGartola, who is going to introduce our speakers. John?
Thank you, Brian. Thank you. Good afternoon, everyone. I hope everybody's doing well in today's environment and staying safe and healthy. As Priscilla reminded me, after dinner when you're done eating, would you kindly put your mask back on? She figured that since I was part of the healthcare system, I'd be the appropriate person to do that announcement. On behalf of Optima Health, we're very honored to be today's presenting sponsor for the State of the Region again this year. It's because of our customers that we're able to do this today, and I want to thank all of our customers for their continued support of Optima Health. And if any of you are interested in trying to help your employee costs around healthcare benefits, feel free to see me or your broker or go to optimahealth.com. That's for you, Steve. All right. With that, we're all excited about today's presentation. We value an economic report as we do, and I'm sure many of you rely on the economic impact of this region, and we're very interested in hearing Dr. McNab's presentation today. This year has been like no other, and I'm sure there's a lot of good findings in his report. Today's presenters are Dr. Robert McNab and Dr. Barbara Blake. And Dr. Blake serves as the Chief Administrative Officer of the Dragas Center for Economic Analysis and Policy in the Strome College of Business at Old Dominion University. Dr. Blake has been a contributing author to the State of the Region and the State of the Commonwealth reports since 2015. She is an LMI Applied Economic Analyst and a Certified Research Administrator. Dr. Blake received a Bachelor of Science from High Point University, a Master's of Arts from the University of Leeds University, and a doctorate from George Washington University. Her latest research on economic misery and opioid death rates was published in the Journal of Applied Economics last month. Professor Robert M. McNab serves as the Director of the Dragas Center for Economic Analysis and Policy. He is a member of the Joint Advisory Board of Economics for the Commonwealth of Virginia and the Federal Reserve Bank of the Philadelphia Survey of Professional Forecasters. Dr. McNab has published over 50 articles and chapters and is the editor of the award-winning State of the Region report. He has appeared in the Associated Press, CNN, Wall Street Journal, Washington Post, Yahoo News, and Yahoo Finance. Professor McNab received his Bachelor of Arts from California State University in 1991, his PhD in economics in 2001, and from the Georgia State University in Atlanta, Georgia. Some years, the State of the Region picture is bleak, other years, much more promising. Regardless of the message, we truly appreciate the honesty and the accurate data upon which the report is based. All businesses in Hampton Roads need this sort of annual benchmark to create strategic plans for the coming year. Ladies and gentlemen, I present Dr. Robert McNab.
Thank you. Well, good afternoon, everyone. And we're here, which is sort of a testament to the resilience of the region, that you and those of you who have joined us online are willing to spend your time to learn about how we have fared in 2020. Now, of course, we will all in about 20 years tell our kids or grandkids about how we hiked up the hill in snow both ways during 2020, combating dinosaurs and meteors. But in all seriousness, this has truly been a year to remember. And while it has been challenging, in challenge there's opportunity. So as we go forward today, I'd like to talk about what we're going to talk about and then make some caveats. So first, I'm going to talk about the impact of COVID-19 on the economy in Hampton Roads, and then delve into the prospects for future growth. Dr. Barbara Blake will then touch upon food insecurity and youth mental health in the region, and then I will come back and conclude with the discussion of the Jefferson Lab. All our materials, including this presentation, are available online on our website at seepodu.com, or feel free to shoot us an email and let us know that you missed something, and if you had a question, we'll be happy to answer it. Of course, without our donors, this report, this presentation would not be possible. These individuals and organizations have seen value in what we do, and without their support, we would not be here. And so we would like to extend a strong thank you to them. Of course, anything we say today, our forecast, our commentary, are our opinions, and we're responsible for them. They don't represent the views of the Governor of Virginia or the President of Old Dominion University. If you have comments, considerations, if you have questions, please let us know. And you could always text your questions to this number on the screen, 757-504-2141. Especially if you're online, this gives you an opportunity to reach out to us in real time and to ask questions. We'll collate those and touch upon them as best we can at the end of the presentation. Those questions we don't get to, I promise I'm going to text you back. Please don't text me at 2 o'clock in the morning with another question, okay? Let's agree upon that to begin. Now, when I came to ODU 4 years ago, every year since then, the presentations have been more upbeat, more uplifting. I had an opportunity to make jokes. I'm just going to be honest, my jokes aren't very good, and this year would be very challenging for me to have humor in the economic environment. So I'm just going to preface with that. COVID-19 is the underlying theme and the underlying challenge we are facing as a region, as a nation, as a globe. In the United States, the behavior of the virus is apparent in the data. We had a peak in April and May when the virus had the highest rates of case mortality, especially concentrated in the New York, New Jersey region. We then saw a decline entering into the summer, another peak in the summer, concentrated in the South and Sunbelt region. And then we now see what's happening. Cases are rising across the United States. In other words, community transmission, the community transmission rate is above 1. This is especially worrisome because COVID infections are closely tied to economic activity and consumer confidence. And what we are seeing is the start of another wave. And what's important to understand is each wave is higher than the next. And as we're entering into flu season, there are positives and negatives. A positive is the mask you're wearing suppresses the spread of influenza and COVID. So we could have a milder flu season if universal masking was adopted. The question is whether we will do that. In the United States, you see that with peak mortality was in April, early May. Since then, we've seen increasing effectiveness of therapeutics. However, still an average of more than 700 Americans are perishing every day from COVID-19. As infections rise, we should expect this mortality to rise in the coming weeks. And so remember, as infections are announced, those positive tests are announced, that hospitalizations and deaths typically lag 2 to 3 weeks behind that. This is a challenge, but it's a challenge that we as a region and as a state have faced successfully so far. If you look at the data, Virginia, on a per capita basis and an absolute basis, has a lower number of COVID cases than many surrounding states, and especially states that we consider as our peer competitors. if you look at the data, you would see that Hampton Roads faced a perilous situation midsummer where cases were increasing, that we as a region were driving case growth in the Commonwealth. That's no longer the case. The recent increase in cases in the Commonwealth is driven by other areas, and you see, yes, we've had a slow uptick in cases recently at the beginning of October, but relative to where we were in midsummer, we're down approximately 2/3. The more important story is one of reduced community transmission. And so if we look at tests and we look at positive tests as a percentage of overall tests, the question is whether or not positivity is increasing or decreasing. Increasing positivity means as you test people, more people are coming back positive, you get increased community transmission. This is a cycle that leads to more cases, more hospitalizations, and more deaths. And you might recall that the governor, when looking at this data, and regional leaders, when looking at this data in midsummer, made a concerted effort to roll back some of the social distancing measures and to engage in more community awareness, to promote masking, to promote social distancing. And one might say, when looking at the numbers, that effort so far has been successful. This is by no means, hey, we're done, throw caution to the wind, nobody has to wear a mask anymore. But this is a demonstration of the validity of the approach when you use science and objective analysis to promote economic development. The rebound in economic activity in the region is closely correlated with COVID cases, as we will see. So the question then becomes, how are we faring? To understand how are we faring, let's understand where we were. If you look at civilian labor force and employment levels, you would see, especially concentrating on the red line, which is employment, that employment came off the lows in 2010. And you could see that employment grew significantly from the trough of approximately 740,000 individuals to 846,000 individuals. And what's more important is if you look at the gap between labor force and employment, that gap has shrunk over time. So not only did we have more people in the labor force, more of those people were employed, which means the unemployment rate declined over the last decade. In fact, if we look at the unemployment rate entering into the pandemic era, the pandemic phase, that unemployment rate was around 3% for the region, slightly below 3% for the Commonwealth, well below the peak observed in 2010 at 8.2%. If we look at jobs, which we go out and ask employers how many people are working for you, you can see that jobs were well off the peak and above that observed prior to the Great Recession. So prior to the Great Recession, approximately 781,000 jobs were present in the region. That had declined to 734,000 approximately at the trough. And in February 2020, we had almost 800,000 jobs in the region. This is why in our forecast in January, we were optimistic. We were looking forward to robust growth in the region faster than the nation because of increases in defense spending, increases in tourism, and that foundation of growth was looking good. However, we all know that with the onset of the pandemic and social distancing measures, economic activity severely plummeted in the region and in the state and in the nation. If one way to look at this is that 464 unemployment claims were made prior to the onset of social distancing. The highest peak was 29,000, almost 30,000 claims in a week, not a month, in a week. And since then, we've come down from the peak, but we're still 4 times higher in terms of people filing initial claims for unemployment than we were pre-pandemic. If we look at people receiving unemployment benefits, that is people who filed, been processed, and are receiving a check, we can see we are down from the peak of 88,000, but we are still 9 times higher than we were pre-pandemic. It's not that we haven't had a recovery, it's that there's a great body of individuals still remaining out there, approximately 5% of the workforce that are receiving unemployment. on a continuous basis. And we have people flowing into unemployment at higher rates than prior to the pandemic. If we look at labor force unemployment this year, you can see the dramatic drop of unemployment with the red line. That is, we go from approximately 837,000 people reporting they were gainfully employed in February to 730,000 by April. That is historic in terms of contraction. That's 100,000 people reporting that they were not employed in 2 months. Since then, we've seen a rebound, and the latest data in August suggests that around 796,000 people were employed. But more troubling, you notice that July to August period, you see a contraction in the labor force, that people are exiting the labor force. We were just having this conversation about why that might be occurring. And if you have school-age children who are learning remotely, you understand that some families are faced with the decision of, do I teach my kids or do I go to work? Because there's only 24 hours in the day, and I can't go to work and have a family and teach my kids and everything else. And so if you look at the latest national data, it suggests the people leaving the workforce, the labor force, in the greatest numbers are women, because they are reverting to familiar care, because many people report anecdotally it's a remote learning, the challenge of teaching their kids and maintaining a familial structure in the time of the pandemic. What does this mean for the unemployment rate? As mentioned previously, we entered into the pandemic with an unemployment rate of around 3%, and you could see this in 2019, and then the unemployment rate jumped from approximately 3% in February to over 12% in April, and has declined since then. But we have to be careful in recognizing that drop from July to August is partially driven by a decline in the labor force rather than all increasing employment. So if you have less people in the labor force and they're employed and more people employed, it makes the unemployment numbers understate the true extent of what's happening with regards to the labor force. Another way to picture this is to look at jobs and to ask what has happened with jobs since the trough after the Great Recession. And while growth was not robust in the region, we can see that by February, we had actually added 65,000 jobs from the trough of the Great Recession. 2 months later, we were 22,000 jobs below the trough after the Great Recession. That shows the speed of the contraction of economic activity in the region. Since then, we've gained jobs back. There has been a rebound, but we have to be careful and recognize this is many people returning from furlough rather than new jobs being created. In other words, people were furloughed on a temporary layoff. They're now coming back to work as economic activity resumes, as social distancing measures relax. But still, approximately 45,000 people remain out of work. Those 45,000 jobs, those people employed, are no longer there right now. If we look at the Census Small Business Survey for Hampton Roads, it asked a simple question: what was the impact of the pandemic on your business operations? In May, 90% of businesses said they had a large or negative impact on business operations. In May, 1 in 7 businesses in Hampton Roads reported that they had to close down at least 1 day a week. The good news is that the numbers have been trending downward in terms of the negative impact. Still, approximately 70% of businesses say there's been a larger negative impact, but the proportion has changed. More businesses are reporting a moderate impact than a huge negative impact. And so we've seen a decline in the top line number and a shift in proportion in terms of the impact from devastating to moderate, which is good news in a bad environment. It's not all bad news. And I know I've started off with a bunch of bad news, but it's just data. We have to just interpret this as the economic condition where we stand. There are bright spots in the economy. One of the bright spots is the rebound in tourism from the lows of the pandemic. So entering into the recession, the tourism sector, especially as measured by hotel revenue, was doing well. Not only did it have historic levels of nominal revenues, But after accounting for inflation, it actually had historic levels of real revenues. But if we look at the impact of the pandemic, you could see how we had to change our perspectives. In January and February, revenues in the hotel sector were running above the previous year. In other words, we were looking like 2020 would be superlative compared to 2019. And then the bottom fell out. People stopped traveling. People didn't feel comfortable going to hotels. And so in April, revenues were, in April 2020, were only approximately 24% of revenues in April 2019. And since then, we've seen a rebound. But remember, the impact has been that we've missed the summer season. And so a large amount of the revenues that would come in the summer season have been muted because of the impact of the pandemic. If we think about real estate essentially has seen a rebound in Hampton Roads from the trough after the Great Recession. And so while nominal housing prices ended up at around $180,000 for the median home in nominal terms in 2011, they climbed back up to $234,000 by 2019. And since then, the market has continued to perform nicely. And one measure of that is looking at the inventory of existing homes. You can see that the inventory of existing homes for sale on Hampton Roads peaked at around 10 and a half months in 2010, 2011. That would be 10 and a half months to clear the market. By 2020, before the recession, it was down to 2 months, and that has continued to decline. In the latest numbers for September, there was approximately 1.7 months of inventory in Hampton Roads of existing homes. And it should be no surprise that when comparing, say, median sale prices for 2019 and 2020, the median sale prices have increased. That, in other words, if you have low supply and low interest rates fueling higher demand for sales, you should not be surprised that median sale prices have increased in the region. So real estate has continued to perform well, and given the statements from the Federal Reserve that they expect to maintain near zero discount rates through 2023, you would expect refinancing and sales of existing homes and new sales to continue apace. If we look at this at the city level, we can see that there have been increases across the region in terms of median sale prices. Not only do we see Newport News values increasing by 11.4% on a year-to-date basis in 2020 when compared to 2019, we see an average increase in median sale prices in 2020 for the region of 6.4% higher when compared to 2019 on a year-to-date basis. In other words, we're again seeing robust demand for housing driven by constrained supply. On one hand, that increases prices, but also lower interest rates, which lowers the price of capital, which increases the demand. One thing we have to also recognize is that if people are competing to buy smaller and smaller amounts of homes on the market, driving up prices, some people can't afford to buy, even with low interest rates, so they end up renting. Where we've seen rental prices increase has been in other portions of the United States on a much faster basis than in the region. The tale here is, yes, we've seen the real estate and rental market perform well in the region, but relatively, Hampton Roads still remains a very high quality and low cost place to live, especially when you compare it to other areas which have significantly greater commute times. It is a comparative advantage we need to continue to market in terms of the viability of attracting talent and firms to the region. Have to end on a slight caveat. One thing we have to be aware of is that the many households, not only in the region but in America, are under significant financial stress. The census conducts a survey of households and asks, okay, what's your expectation of being foreclosed or evicted upon in the next 2 months? It's a signal of whether people believe they can remain in their current state of housing. And if you look at this, it's a very interesting picture between the United States and Virginia. In the United States, homeowners on average are much less likely to foresee foreclosure than in Virginia, but many more renters across the United States feel that they're more likely to be evicted. Now, the CDC's recent order on the moratorium of evictions may tamper these expectations in coming surveys, but the question is, at some point, that moratorium has to expire, and also you're imposing costs on landlords. How to compensate landlords for this moratorium is an unanswered question. And then, even if you can try to get an eviction order, you have to get it through the courts. There may be a massive backlog in 2021 in terms of trying to process properties through the evictions or foreclosure process. So one of the pieces of good news, one of the relative strengths of Hampton Roads has been defense spending. It has essentially placed a floor in economic activity for the region. The good news, tempered with some bad news, is that the expectation is that the defense budget will continue to increase in coming years. That is, we will see a proposed budget from the president in FY22 that's greater than FY21, and the Pentagon expects that the defense budget will grow at the rate of inflation for the next 5 years. The question then becomes, given its impact on Hampton Roads, given that direct defense spending in Hampton Roads is estimated to be approximately $23 billion out of a $100 billion economy, roughly, in 2020, what happens when we start talking about deficits? And one way to think about this is look at the fiscal year deficit by month. So here's 2016, where the annual deficit ended up at approximately $500 billion. 2017, 2018, 2019, 2020. So at the end of August, the federal government deficit was approximately $3 trillion. Probably will close the fiscal year around 3.2 to 3.3 trillion. Even in Washington, D.C., that's real money. So that means you're borrowing at a very rapid rate. That means gross public debt is now 26, 27 million. It's impossible to keep track because the debt clock is spinning so fast. What does that mean for defense? At some point, it means that choices are going to have to be made. And those choices may imperil economic growth in the region if we cannot invigorate growth in other sectors. As we talk about the impact of COVID-19, we have to be aware that it has not been proportionally distributed in terms of impacts. In other words, not everybody's been the same with respect to the recession or the virus. One way to think about this is first ask a simple question. What's happening with permanent job losses? Because many people have experienced temporary furloughs in this pandemic, but we're starting to see a transition to where temporary furloughs are converting to permanent layoffs. So let's compare to previous recessions. So here we're comparing permanent job losses over peak employment prior to the recession. And you could see that permanent job losses in the 2001 recession accumulated. They peaked at approximately 1.5% of peak employment, and then by 64 months later, after the initial peak, the economy had recovered. This is why we call the 2007-2008 recession the Great Recession, because temporary job losses accelerated into the recession and essentially bottomed out about 4% of peak employment prior to recovering. And the recovery took 100 plus months for the nation. The cautionary tale is what's happening right now. That we're seeing an acceleration of permanent job cuts, an acceleration faster than any previous recession. Why? Because of the impact of COVID-19, because businesses can't operate as they would normally, and so we are starting to see the impacts on that, on business closures and on employment. And we have to recognize one thing: as we get colder, businesses that have been able to survive on outdoor dining, the outdoor experience, are going to face a very tough choice. Do you try to continue to do that in New York City in the middle of winter, or Kansas City in the middle of winter? Or do you look at this and say, this is just too steep a hill to climb, I can't make it anymore? And so we should expect, unfortunately, an acceleration of small business closures into the fall, into the winter, unless there is another stimulus package. But we have to then go back and talk about government debt about that. If we look at the unemployment rate by race in the United States, where the data are available, we could see prior to the pandemic that unemployment was relatively low in February 2020 across the races. It then jumped up dramatically with the impact of social distancing and COVID-19 and shutdowns, and has recovered, but still not equally. We can look at this by here. So let's look at first the distribution of the population in the region. Approximately 30% of the population is black or African American, about 59% are white, 4% Asian, 7% Hispanic. The latest continuing claims data for September shows a distribution of unemployment claims that speaks for itself, that a higher percentage of individuals who are on unemployment are black or African American, and some of this has to do with occupational choice, where people are what? Working. And those industries that have been most dramatically affected by the pandemic happen to be more face-to-face, more social, tourism and hospitality, retail, restaurants, etc., which happen to be what? They happen to employ more black or African Americans than other individuals. So this is why we're talking about a K type of a recession. That a recession where if you're highly educated, highly skilled, able to remote work, then the impact of the pandemic is much less significant than if you are in retail trade or tourism or hospitality and you have to engage in face-to-face work. So we've seen disproportionate layoffs and we've seen disproportionate unemployment, and we've also seen food insecurity increase in the region, and Dr. Blake is going to talk more about that. But this is how rapidly the economic impact came to Hampton Roads. Prior to the pandemic, approximately 9.9% of the population in the region was receiving SNAP, or food stamps as you might call them. Within 5 months, that jumped 11.4%. That's roughly 25,000 more people receiving SNAP benefits in about 5 months. That is a significant change. One of the things we've talked about and we need to be aware of is the unequal distribution of COVID-19 infections, hospitalizations, and mortality. We have good national level data on that, much less perfect Virginia data. Why? Because Virginia, still about a quarter of the observations do not have classification for race. And so that's why I'm relying on national data to make this observation. So this is the distribution of the population in the United States. So one way to think about this is what percentage of the US population identifies as either Asian, black, or African American, white, or Hispanic on census data. The CDC then corrects that for where COVID-19 has occurred. So they say, okay, we need to look at where COVID-19 has occurred and reweight the population to look at the population that's susceptible to possible infection. And then you look at the distribution of mortality from COVID-19. And the big thing to be aware of is for black or African Americans, you could see that while they are approximately 12.5% of the total population of the United States, they account for almost 21% of deaths. Hispanics, while they are approximately 18.5% of the population, account for approximately 21.3% of deaths. And so for black or African Americans, not only are they more likely to live in areas that are susceptible to COVID-19 infections, they're more likely to die from it than other races. And that creates anxiety or depression. Not only do we have financial impacts, we have the possibility of infection and the possibility of having to teach your kids remotely and to have to adapt your lifestyle to the new normal. And so prior to the pandemic in 2019, in surveys, approximately 11% of households reported symptoms of anxiety or depression in the United States. We're now averaging around 36%. So one way to think about this is prior to the pandemic, roughly 1 in 10 households had exhibited symptoms of anxiety and depression. Now, it's more than 1 in 3. And if we break this down by race, you could see there's disproportionate impacts, especially after the burst of economic activity in the summer. You could see for white respondents to the census household survey, that still 1 in 3 by September 14th reported symptoms of anxiety and depression. For black or African American households, this was almost 39%. Asian households saw a significant ramp in symptoms of reported anxiety and depression in midsummer, coinciding with language about COVID-19 and protests. But that has significantly reduced in the latest sample. And Hispanics are continuing to report the highest signs of anxiety and depression among households in the census survey. Regardless of where you stand, this suggests that we are under enormous stress as a society, socially and economically. This prevents us from functioning well, but it also presents challenges in terms of economic development because these are going to be demands for services that will reverberate well past the end of this recession and pandemic. So in the most optimistic scenario, looking forward, the CDC says even if we had immediate emergency youth authorization of a vaccine, they might be able to distribute 35 to 40 million doses by the end of the year. That was an estimate in September. We're now in October. That is lower, likely even lower. The problem when you approve a vaccine then becomes a distribution chain problem. And anybody in supply chain management can tell you it's one thing to have a bunch of goods, it's another thing to get them to people. And so whether or not supply chains for vaccines are robust enough to move out 30 to 40 million doses in short order is an unanswered and untested question. We also have to recognize that a good proportion of the US population and here in the region are vaccine resistant. And whether or not we will see people widely adopt a vaccine is questionable in the short term. And that's why the CDC director said, in the short term, a mask is your best form of protection because we have empirical evidence on how it reduces the community spread of COVID-19. The good news for defense is we expect, regardless of changes of administration, that we will see shipbuilding continue. The Navy just came out with an increased shipbuilding plan. But that will have to be tempered with increases in public debt. And the port just reported in their stated report recently that they've seen a rebound in trade activity, and Goldman Sachs projected that we should see trade volumes increase in 2021. For tourism and hospitality, they've already pivoted to the drive to us vacation, that recognizing that travel volumes by air are going to be significantly lower, that they will actually have to change their marketing strategy to get people from surrounding states to come here. And that brings us to the challenge of invigorating growth beyond the three pillars that Brian mentioned in his introduction that we are collaboratively talking about. Dr. Blake.
Thank you, Dr. McNab. Before I begin on the research review of food insecurity and youth mental health in Hampton Roads, I want to just take a moment and say, you know, over 21 years ago, the State of the Region report really started as a mission to talk about how to make our region better. And so even though we may be discussing some very disturbing topics, some concerning issues, I know that we all embrace an arena where we can have this civil discourse, that we can talk about these problems and issues and get ahead of them. That's what I'd like to think. So first, let's go ahead and take a look at food insecurity in Hampton Roads. One of the very first things that we needed to do in this report is that we needed to talk about this term, food insecurity, that we first really saw adopted in 2006. And that is because it's not your grandmother's hunger. Every one of us in this room, online, we have felt hunger. We've known what it is to be hungry. But do we know what it means to be food insecure? So that is very different from what we might think of as hunger 50 years ago. So food insecurity is defined as an individual or a household that doesn't have reliable access to healthy food. This is meal skipping. This is watering down formula. This is going to a food pantry because the one meal that you had in the day is done, and you don't have anything to eat at night or to give your children at night. So food insecurity, and really reframing that to where we are in 2020, is important. Now, this was a topic that was quite complex prior to COVID-19, and now we find ourselves facing tremendous food insecurity because of the pandemic. So what I will do first is I will talk about the data for our region, and then I'll also talk about our resources from the federal government and from our nonprofits locally, and then we'll talk about some policy options. So when we look at food insecurity in Hampton Roads, 1 in 10 is food insecure. Over 180,000 that we know of. Over 54,000 children are food insecure. Many of us are aware of the multiple studies that tell us what happens to kids when they're hungry and they don't have access to nutritious meals. A recent Hamilton project listed a whole host of medical ills, such as a rise in asthma, likelihood of anemia, lots of problems. So we know this, but ultimately, how do we fight persistent food insecurity? Because guess what? When we have low unemployment rates, we still have food insecurity. So it is a complex topic to try and handle. If we look by race, these are national stats, but if we look by race, Hampton Roads is following very much behind these statistics in that Black and Hispanic households are more food insecure. These households, on average, make lower wages, and these households have lower race. So race does matter. Race does matter. And this contributes to a larger conversation on food and access to healthy food. If we look at federal programs, which is sort of a first line of defense to combat food insecurity, in 2019, the federal government spent $92 billion to alleviate this problem. $58 billion were for SNAP. So SNAP is really your first line of defense, sometimes referred to as food stamps, sometimes referred to as EBT. And then we also have WIC, Women, Infant, and Children, and then a significant player is our school systems with breakfast and lunch programming. So it's important to remember that in Hampton Roads, 1 in 10 is receiving SNAP benefits. SNAP benefit recipients include the disabled, the unemployed, single parents. And so SNAP really works very hard to provide the resources necessary. If you look at the graph there online, you'll see that when we look at the lunch programs and the breakfast programs, 47%, almost half of Hampton Roads students were eligible for free or reduced meal costs. That varies by locality. For example, in Norfolk and Newport News, 3 out of every 4 children are eligible for free or reduced lunch. So there are amazing programs that are there because undoubtedly this is a huge need. The Kaiser Family Foundation surveyed Americans since February, and they found that 1 in 4 Americans had either skipped a meal, applied for or received SNAP benefits, or went to a food pantry for food. So very necessary, these programs. If we look locally, there's a whole series of nonprofits that are really the second line of defense. If you know anything about a food bank, I'll tell you what the definition is. So a food bank is really a warehouse of millions of pounds of food. And in our region, the Food Bank of Southeastern Virginia and the Eastern Shore and the Virginia Peninsula Food Bank are our resources for getting food to those who need it. Keep in mind that SNAP benefits after the first 2 weeks of the month are almost expended, 75%. So in the first 2 weeks of the month, for those people who do have SNAP benefits, they're gone. So that those last 2 weeks of the month, they're gone. Where are they going to go? And then for those who don't qualify for SNAP, and maybe they're living until their next paycheck, where are they going to go? So the food banks and their agencies are tremendous. As far as efficiency is concerned, the food banks are very efficient. A $10 monetary donation can be used to obtain and distribute $60 worth of food. So filling the gap with our food banks and our other partners, agency partners, are crucial to meeting the needs of food insecurity in our region. Now for COVID, now more than ever. So when we come to a policy question, how do we alleviate this? And I want to go back to an earlier comment that I made, is that food insecurity is persistent. It's what's known as being sticky. So even when we have higher participation rates in the workforce, even when we have low unemployment, why is it that food persistence just keeps hanging around? What are the issues? And one of the real themes that I think we need to talk about in this chapter and the next is this idea of stigma and embarrassment and shame. Anyone can find themselves food insecure. You may remember in 2013 and in December 2018, 2019, we had a government shutdown. Even people who had that sure, steady federal paycheck that was always going to end up in the bank account, they didn't even have that coming in. Anyone can have their ID hacked and their checking account cleaned out, to be refunded in 30 to 60 days. Anyone can find themselves, especially in our COVID world, find themselves in a situation where they need assistance. So we need to put away the stigma and the shame. Oh, well, we don't need those benefits. Those benefits are not for us. Food insecurity can happen to anyone. So a couple of things. Food banks, efficient machines of allocation and distribution, donate and volunteer. Have the employees in your office donate and volunteer. Very worthy organizations for that second line of defense, and in some cases, a first line of defense for food insecurity. Promote financial literacy. Once again, maybe a little twinge of shame and stigma. It's called adulting. It's called juggling life. You have so much money. How do you pay the rent? How do you pay the car payment? How do you pay health expenses? Who teaches you to do that? Who taught you to do that? Did you have a mentor? What if you don't have a mentor and you don't know how to do those things? So financial literacy is a key to economic fragility. Prioritize K through 12. Unfortunately, today we don't have the time necessary to really talk about the role of public schools in Hampton Roads during the COVID, really when we had school closures in March. But school systems have been doing a tremendous job providing grab-and-go meals for lots of households that would not have access to the food needed for their stay-at-home kids. Okay? And then, like I said, lastly, minimize the stigma and strive to ensure that everyone has benefits equally. Going back to K through 12 schools, if we all remember our cafeteria experience, who got free and reduced lunch? Was that known? Was that a secret? Was there a rich line? Was there a poor line? We need to destigmatize, and we need to look at if we have kids in our high schools that need to have food, then they get it, if they forgot their lunch number or not. So destigmatizing, especially for our most vulnerable, we know in K through 12 schools, we've got them until at least the age of 16. that we can feed those kids. So ultimately, like I said, you know, they may be complex topics that we're trying to tackle, but definitely our conversation of these topics will help improve our region. So next we have youth mental health in Hampton Roads, another very complex topic. We know that COVID now has brought upon a lot of stress and anxiety. Dr. McNab reviewed some of those current statistics. Since a lot of times, you know, we're live and in the event, we don't really know. We can't collect that data real time, so, you know, in 6 months or a year from now, what will we find in 2020? But ultimately, youth anxiety is on the rise. So if you see in 2007, 8% of adolescents 12 to 17 had at least one major depressive episode. You know, a major depressive episode, that's a variety of symptoms. That could be loss of sleep, appetite changes, feelings of worthlessness, and unfortunately, thoughts of suicide and suicide attempts. In 2017, that had risen to over 13%. So we see some startling trends among girls, among youth and lesbian and gay communities. So we need to talk about this topic. Youth mental health is health. It's one facet of how we maintain ourselves. And so starting with our youngest Virginians is very important. And unfortunately, because of the statistics that tell us anxiety is on the rise, probably the worst one is that now suicide is the second leading cause of death for 10 to 24-year-olds. That is behind accidents. So when we look at CHKD, who in 2022 will be opening a new mental health hospital, we can see the incredible increase of consultation and visits for mental health concerns. So you see where we were at in 2015, and now for the budgeted 2020 year, it's just an incredible, incredible increase. About a decade ago, conversations were happening at CHKD about how this could be how this challenge could be met. Unfortunately for our area, there is a lot of need. We have a lot of children with problems and not enough service providers. The new mental health hospital will provide urgently needed services, and more importantly, for existing providers in our area, support them in their efforts. So it's an upbeat and very happy topic for us to review today, that we have this new state-of-the-art $224 million facility that will be opening. CHKD is already a top employer in our area. 400 new staff will be there. This includes child psychiatrists, nurses, chaplains, mental health coaches, with an average salary starting around $75,000. So by 2022, there will be outpatient, inpatient, and partial hospitalization programs. All the rooms will be single. A parent or a family member or guardian can spend the night with those individuals. So lastly, where do we go from here? Left unmet, youth mental health problems are linked with a whole host of issues: academic problems, health problems, dropping out of school, delinquency. So we need to get ahead of this issue. One suggestion would be to improve mental health funding for our school systems, more counselors, more resources. And it's a life investment, isn't it? So that when you can teach those coping skills, juggling skills, to children, that is something that we will hope would become, allow them to become resilient adults. Work to remove stigma surrounding mental health. I think in light of COVID, the pressures the extreme, I believe the word is unprecedented times, that we've never been through any of these situations before. Social distancing, the closure of schools. We all need to stop and acknowledge that mental health is important for all of us to maintain. So working to remove that stigma, especially regarding suicide, we need to talk and have those open conversations. Mainstream mental health training for all. If there's someone in your office that has the first aid kit, knows CPR, and knows first aid, does that individual know how to react to a mental health emergency? That is an example of mainstreaming and normalizing mental health training. On a personal level, the crisis line, 741-741, 24/7, you can text anything you want to, and you will receive a response. In July of 2022, in the country, we will now have a new national emergency health hotline, 988. The average care line cost is around $25 per call. And so with that expectation of being able to have that 988 number to really get folks out of that 911 pipeline so that they can speak with someone specifically trained to deal with a mental health issue. So this is all a part of that continuing dialogue to destigmatize and talk about mental health. Mental health is health. And so if we can do that, and this region is certainly fortunate to have the new CHKD Youth Mental Hospital opening in 2 years, that we're going to rise and meet that challenge. And at the end of the day, there is hope. There is always hope. So we will turn it back over to Dr. McNab, who will finish with our Jefferson Lab.
One underlying theme we were talking today about is not only the challenges we face as a region, but opportunities we could seize upon to essentially invigorate growth in the coming expansion. Because I know times may seem dark now economically and the challenges seem steep, but we know that at some point an economic expansion will occur, and most of us think it will occur in 2021 on a sustained basis, and GDP will recover to its levels in 2021, 2022. The question is, what will we look like? Where do we want to grow? Do we want to revert to old habits or invigorate growth beyond the 3 pillars of the economy? Not saying that the 3 pillars are wrong, but to add some spice, one might say, to the economic development puzzle. And so the Jefferson Lab is an opportunity in that STEM, science, technology, education, mathematics field that we can look at and say, here represents a comparative advantage for the region, that we can work together in collaboration with a federal national laboratory to increase STEM education and application in the region. For many of us, the Jefferson Lab is, well, more known for its SOL tests, and where we send our kids to prepare for science standards of learning tests. They run a website, and so when you ask parents anecdotally, well, what's the Jefferson Lab? Well, I know my kids got to go to Jeff Lab. They got to learn science there. Did you know that they had cutting-edge physics research? No. It's not humorous, but it also is insightful in a way we need to market our comparative advantages better as a region, because it has the world's largest and most powerful free electron laser in there. It has cutting-edge, well-paid scientists who engage in questions of not only the basic nature of the universe, but in terms of applying those research outcomes to questions of medical imaging, technology, growth, etc. And so the Jefferson Lab may be at a crossroads. Maybe it just didn't win the recent decision to build a new facility, and that went to Brookhaven instead. But if you look underlying the data, Jefferson Lab has a comparative advantage in terms of cost. It has a comparative advantage in terms of its proximity to universities. And while we could say it is at a turning point, turning points are opportunities for growth. And so if we look at it, we could see that it employed approximately 721 individuals in the latest data. Some of those are jointly appointed with universities in the region. And what is characteristic about these jobs is that they earn 60% above the prevailing wage in the region. So it's not just talk about bringing STEM jobs to the region, this is where some STEM jobs are actually. And if we could grow partnerships in the region collaboratively with the Jefferson Lab, we would see what? Not only a facility that spends approximately $140 million a year on operations, but a facility that has annual investments that flow into the economy in terms of construction. And so its economic impact is much wider than just the expenditures that happen. It has a far-reaching impact by serving as a world-class facility that educates children in the region on science and technology, education, and mathematics, and serves as a practical example of how those lessons are applied in real life. So the big challenge coming forward is how Jefferson Lab is going to pivot, and pivoting it is, to ideas in medical imaging, environmental cleanup, and big data. Everybody loves big data. They're actually working on it. And fostering those public-private partnerships, there's something we need to look at. Here's a federal laboratory that has people with ideas that can be married with the business community to formulate startups and entrepreneurial visions. The question is, how do we create that bridge between the two? Is it just between the lab and the universities, or can we foster a relationship that brings the private sector in to create those innovative relationships we see in other technology-rich regions? Now, some of this is going to take concerted effort in terms of a legislative agenda. That working together as a region, we need to just essentially, as it says in the chapter, go knock on doors, shake trees in Richmond and Washington, D.C., and make sure money falls out. Because this lab, like many other labs, requires money. And people can't say, well, we don't see a return. Because sometimes basic research is basic research that informs entrepreneurial visions that lead to exciting developments. One of the most exciting things you might see on occasion is SpaceX, for example, landing a rocket ship on a barge in the middle of the Atlantic. By the way, that's math. That's the practical application of math that has its roots in its collaboration with Stanford and other universities. We should be looking to foster similar things. We have Langley here with NASA scientists. We have Jefferson Lab with Jefferson Lab scientists. These are comparative advantages, especially when we compare ourselves fairly or unfairly to other regions surrounding us, because we could leverage these to argue with companies to found here, develop here, and grow here, because that's the big challenge for the region. We now have a story that I started out with. That story is, yes, we experienced an economic shock, but we didn't experience the public health shock like many other metropolitan regions in the United States. We saw a challenge emerging in the summer and took concerted action as a public and private community to reduce the rate of infection and reduce infections, and now universities have successfully reopened without the widespread COVID cases we see in many other places. That is an economic development success story. Why? Because this will happen again. H1N1 was only 2009. Remember, Ebola was 2014. These type of fevers, these types of viruses are emerging on a continual basis. Regions, I would argue, that have the capacity to observe scientific advice and data and put it into policy and will win the economic development in the coming years. Because what we saw in the literature, what we've seen in the research, especially when we look back to the 1918 pandemic, is that regions that took these measures seriously in terms of masking and social distancing, what we call today masking and social distancing, grew faster over the coming decade than regions that tried to remain open and suffered a much greater cost in terms of mortality. So by placing ourselves in that STEM space, that STEM entrepreneurial space, we can invigorate growth beyond the 3 pillars while continuing to what? Work with the 3 pillars, because that's our comparative advantage to some other regions. So it's not all doom. While much of this may seem gloomy, remember, the light at the end of the tunnel is not a train. It's what you make it. And that's how we have to look at it moving forward as a region. If you like the report, it's available online. If you have questions, please feel to text the number there. Follow us for updates. Thank you all online for coming today. We'll now take your questions. Yep. Oh, I gotta put my mask on.
You have the questions.
Okay. We are adhering to social distancing by working with text, but also if you have questions, I'm sure we could figure something out if you're in person and texting is a challenge, because texting for me is always a challenge. I don't get emojis. So let's start with this one, Dr. Blake. What is the role of food deserts in Hampton Roads in the issue of food insecurity?
Great question. So for those of you who are not aware of what a food desert is, a food desert really is a geographical area where individuals do not have access to any type of food, especially fresh food. We've had food deserts historically for a very, very long time. I think if we look in the past decade or two, really seeing a food desert come up into the national discussion and as a region. You know, we're here in downtown Norfolk in the St. Paul's area, who had a Save-A-Lot for a long time, was vacated. And so think about the impact of a food desert to an individual who is food insecure. You don't have a car, you have limited funds, and the nearest grocery store is 30 to 45 minutes away. How are you going to get there? How are you going to transport your groceries on a bus? Not going to get a lot, I imagine. And then, of course, if you were able to get to the closest, perhaps the pricing of that particular store is not the best, and you have limited funds. So food deserts are very crucial. I do know that both of our food banks work to alleviate food deserts with mobile pop-ups. And once again, just go back real quickly to food insecurity. Yes, canned goods, shelf-stable, those items are very important. But what about the dairy? What about fresh fruits and vegetables? And so that's an element of that definition of food insecurity. Nutritious foods. Someone who eats a cup of noodles and soda is not going to have a lot of benefit nutritionally over someone who has fresh fruits and vegetables and dairy. So it's a huge role.
So next question is, with the temporary payroll tax cut implemented in this fall, do you expect it to negatively affect the economy when it all comes due again in 2021? So those of you who may not be familiar, the president, through an executive order, deferred payroll tax collections until January 1st. For federal government employees, that became a mandate. For state and local government employees, that depended upon their governor, their mayor. For private firms, it depended upon the private firm. Why? Because many HR systems aren't able to toggle on and off between payroll tax collections and then toggle back on January 1st, because those deferrals come due on January 1st. It's like, oh, I'm gonna give you $50 for your paycheck, but then 3 months later, you gotta give me that $50 back. So it feels like what? It feels like a tax increase on January 1st. So because it's been implemented in a somewhat haphazard fashion across the country, it's going to have to be a legislative fix. Congress is going to have to figure out how to essentially hold harmless employees, but then that creates inequity issues, because if you're working in a firm that said, okay, we're going to defer your payroll taxes, and you're working in another firm that's, no, we're not going to participate in that, and one person is held harmless and another person is, well, you're just out of luck, you didn't get that. That's going to create inequities in the system that nobody's talked about. And merely just forgiving it is a problem, because those monies come out of the Social Security Trust Fund, and so you would need to compensate that with a transfer like it's been done before with money from the general fund, but we know the general fund is running a multi-trillion-dollar deficit. Last fiscal year will probably run at least $1.5 to $2 trillion this year. That's more money you got to borrow. So, you know, all in all, given the haphazard implementation and take-up rate on it, probably not much of an economic stimulus. It could, however, if Congress does not act, essentially slow down economic growth in the first quarter when people see their payroll tax contributions come back, not only come back, but double. Brian, I see you with the mic.
Yeah, I do have a question, if I could. And I want to ask you to expand on your closing comments.
Okay.
If we were to best case things, that we've got immunizations, we get them distributed, and things are starting to get back to normal, how quick can our economy recover to the levels it was in 2019? And what can we do, especially in the business community, to truncate that?
Okay. So the first assumption is emergency use authorization of a vaccine, which is a high degree of uncertainty. And the second assumption is that you have a distribution channel to push that vaccine out. I am not a virologist, epidemiologist, doctor, nor do I play one on TV. So take everything I say with a grain of salt and run to your doctor. But let's assume that millions of doses start becoming available in 2021. The uptake rate is going to be the big thing, because if we take this room and everybody to my left takes the vaccine and everybody to the right doesn't, and then we all don't wear masks, it doesn't work, because we don't get a sufficient amount of people with the vaccine to develop an immune response. So what happens is, yes, you're moderately protected, but amongst them, they're not moderately protected by your protection. It's like having measles, mumps, rubella vaccine, right? Why do we require it for schools? We got to get up to a certain specific threshold, because there's some people who can't have it. And so by all of us taking the vaccine, you reach that level of herd immunity that the virus gains no traction in the population. So, question is, what can businesses do? Well, first thing that businesses can do is be leaders in the community, I think. If a vaccine is available and everybody has confidence in it, who's going to step up and be the first one to take it? Because that's the signal that you have to build confidence in your employees. It's not going to your employees and say, you take it and I'm going to sit over here and see what happens. It's people are going to have to serve as leaders in the communities and demonstrate the effectiveness, because there's going to be resistance from people who were vaccine resistant prior to all this coming, and now there's political vaccine resistance on top of that. And so objective data, objective analysis, just trying to be very, very straightforward and transparent with people is going to be the crucial thing for private leaders and public leaders in the coming months. When can growth come back? I think, again, if everything goes well and we continue to wear masks as the vaccine is distributed, then 2021 midsummer and into fall will start to look more quote-unquote normal than the early part. Right now, we're entering into a very hazardous, precarious situation because we don't have a widely distributed effective vaccine in the coming months, and COVID infections are increasing. And so we have increasing community transmission, which leads to increasing hospitalizations, increasing deaths, on the top of a flu season that's coming, and which is why, you may have heard me say this, wear a mask, please. Because the empirical data that comes out is that this is our best protection to invigorate economic growth as we distribute a vaccine to the population, so we no longer need this. How's that?
No, I would agree. I think the key is employee and customer confidence, and how do we gain our employee and customer confidence back. I would think, and this is purely my opinion, that we're going to have to operate in this environment of persistent threat at least through 2021. I mean, we're going to be seeing ourselves in this room like this probably for another 10 months to a year. Rolling into 2022, we have to ask ourselves, how do we accelerate the economy?
Right.
How do we put it on overdrive? And how do we come out of 2021 in an accelerated fashion?
I think one of the best things we could do for ourselves is reset our expectations of normal. That we keep looking back and saying, oh, look, the Super Bowl was in January, well, I won't mention the result, of 2019. Niners should have won, but anyway. But that's what we want to return to. No, what we want to return to is first getting the kids back in school in a safe fashion, promoting economic activity safely, and then normality will follow. Trying to impose normality doesn't work because the virus is apolitical and it gets the ultimate vote. If you're careless or riskless, as you know, the virus doesn't care. And so I think resetting our expectations and really, as Dr. Blake said, understanding the stress that is on our families, on our employees, on our customers, and developing mechanisms to promote mental health is going to be huge in 2021 because if our employees are stressed, they're less productive. If their kids are stressed, the families are under stress, everybody's less productive, less in terms of education, in terms of businesses, et cetera. Those new coping mechanisms, by the way, promote economic development in the future because we've really undersold the idea of mental health in the past. And so adapting that into our new normal, I think, is going to be an effective economic development mechanism.
Do we have other questions in the room?
You have to sell.
And Bob, I don't know if you have more questions in your text.
I have to look at my phone. I'm not surfing the internet. I'm looking at. Everybody's like, he doesn't even want to listen to himself. And so here we go. Speaking of, okay. So the question is, and this is more an epidemiological question, do you believe there's any correlation with a high population of active duty military, a population that's bound to observe rules controlling protective measures? Anecdotally, you know, when you have 80 to 100,000 active duty people in the region and their families, and they are essentially ordered to wear masks and engage in social distancing, that serves as a cultural signal. And so this is a very interesting hypothesis we probably should look at, because do regions where you have higher concentrations of active duty military, have they had less COVID-19 infections? There are some counterexamples in Florida and Texas to that. So I think it's not only proportion of active duty military, it's a state and regional message also. That if you looked in midsummer what the mayors were saying around the region, they were concerted in saying this is a serious problem, we need to take this seriously. If it gets out of control, we're going to have real issues. And at a local and regional and state level, there was concerted action to tamp down the transmission rate and cases throughout the region. I think that's one of the success stories we have to essentially say is places us well in the spectrum of responses to COVID-19.
You have the questions.
One more question? I keep dragging out my phone. Let's see, do you expect any regional impact or growth due to reshoring of manufacturing due to supply chain interruptions? So this is a great question, right? One of the things that the pandemic and trade wars have exposed is the fragility in part of medical supply chains globally. And so the question is whether or not we will see increased incentives at the state and national level to reshore activities, or whether this passes quite quickly. One would hope that we start thinking about, okay, what are capabilities we need to have domestically, even if they cost somewhat more, because what we've seen is in a global pandemic, everybody's competing for the supplies, and you end up responding to market forces, which may run counter to your public health incentives, which result in shortages, which could create additional problems. So really can't answer that question because we have to see what develops in the tax code and the expenditure and policy in DC after the election in 2021. That's all I got.
The questions. You have check to see if there are any more questions.
Let's
And
see.
there is also a mic in the back of the room if there's anyone on the floor that has a question.
I think we're good.
Okay, so that was the end of our questions. Thank you.
Dr. McNab, Dr. Blake, thank you so much for all that information. I just want to make a couple of comments, and this is unscripted, so Priscilla, I apologize. I was having a conversation with an individual in the room before the event started today, and he was telling me how he and his wife decided to cancel their vacation this year, and they decided to stay local and vacation local. And he said he was absolutely amazed at the assets and the things that we have right here in Hampton Roads. And I commented to him that, isn't it amazing that we get to live, work, and raise our families in a location that most people come to vacation? And we don't often realize it because we're in the middle of it. We live here, we work here, and sometimes we're blinded by the trees because we live in the forest. But Hampton Roads is a wonderful place. And I can tell you this, we have regional leaders that are working every single day to make it even better and to ensure that we get through this pandemic. I can't tell you what a reinvigorated, world-class economic development alliance we have with the leadership of Doug Smith. I can't tell you what a great workforce development organization we have under the leadership of Sean Avery. I can't tell you how great our colleges and universities are. I can't tell you how great our Planning District Commission and our Transportation Planning Organization is under the leadership of Bob Crum. We've got a Hampton Roads Transportation Accountability Commission that has appropriated over $5 billion of transportation projects here in Hampton Roads under the leadership of Kevin Page. Things are happening that most people don't see. So don't get despaired. This economy is going to recover. We are going to be a world-class region here in the next few years, but we need everybody to stay safe. We'll get through this pandemic. The economy will recover if we just work together. So again, I want to thank Old Dominion University, the Dragas Center. I want to thank Dr. McNab, Dr. Blake. Thank you so much. We look forward to your presentation next year. We love the partnership that we have with ODU and the Dragas Center. Thank you all for coming. Everybody stay safe. This concludes the event today. Thank you.